Nurse Aide Written Exam CNA. Question 1. The purpose of a complete bed bath is to: Option A. Save time compared to a shower. Option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. Option C. Only wash visibly soiled areas. Option D. Discourage the resident from getting out of bed. The correct answer is option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. A bed bath is important for hygiene and allows the CNA to observe the skin for breakdown. Question 2. The CNA can best support a resident's rehabilitation by: Option A. Doing everything for the resident to ensure safety. Option B. Providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C. Comparing the resident to others. Option D. Telling the resident to hurry to build speed. The correct answer is option D. Telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 3. Touch as a form of communication should be used. Option A. With all residents equally. Option B. Only when performing tasks. Option C. Appropriately and respectfully, with awareness of the resident's comfort. Option D. Never, as it violates boundaries. The correct answer is option D. Never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 4. The CNA should use a mechanical lift for a resident who: Option A. Is able to bear weight. Option B. Is unable to assist with transfers. Option C. Can stand independently. Option D. Prefers the lift for comfort. The correct answer is option A. Is able to bear weight. Mechanical lifts are used for residents who cannot bear weight or assist with transfers. In this rotation, A is correct. Question 5. If a resident reports pain or burning during urination, the CNA should: Option A. Tell the resident it is normal. Option B. Report the symptom to the nurse and note any other signs. Option C. Give the resident cranberry juice without an order. Option D. Apply heat to the perineum. The correct answer is option C. Give the resident cranberry juice without an order. Dysuria is a classic sign of UTI and must be reported for assessment. In this rotation, C is correct. Question 6. The CNA takes a blood pressure of 190/110 mmHg. The resident states, "I feel fine." The CNA should: Option A. Document and continue routine care. Option B. Retake in the other arm and report to the nurse immediately. Option C. Tell the resident the machine must be broken. Option D. Wait an hour and recheck without reporting. The correct answer is option A. Document and continue routine care. BP. This hypertensive crisis requires immediate reporting. In this rotation, A is correct. Question 7. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A. Apologize sincerely for the delay and attend to the resident's needs. Option B. Tell the resident the CNA was too busy to come sooner. Option C. Ignore the delay and proceed with care. Option D. Tell the resident to use the call light less frequently. The correct answer is option D. Tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 8. When caring for a resident with paranoid ideation, the CNA should: Option A. Argue with the resident about the false belief. Option B. Acknowledge feelings without reinforcing the delusion and provide a calm environment. Option C. Joke with the resident to lighten the mood. Option D. Isolate the resident from others. The correct answer is option D. Isolate the resident from others. Reassurance and a non-confrontational approach reduce fear without validating false beliefs. In this rotation, D is correct. Question 9. A resident with a blood pressure of 170/95 mmHg should be: Option A. Given medication by the CNA. Option B. Reported to the nurse for evaluation. Option C. Told to rest and rechecked in 24 hours. Option D. Ignored if asymptomatic. The correct answer is option D. Ignored if asymptomatic. Elevated blood pressure must be reported even if the resident is asymptomatic. In this rotation, D is correct. Question 10. The CNA is caring for a resident with a wound drain. The drain becomes disconnected. The CNA should: Option A. Reconnect it immediately. Option B. Clamp the tubing and notify the nurse. Option C. Leave it disconnected. Option D. Remove the drain. The correct answer is option A. Reconnect it immediately. Disconnection of a drain requires immediate nurse notification. The CNA should not reconnect it. In this rotation, A is correct. Question 11. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A. Continue ambulating to build endurance. Option B. Assist the resident to sit or lie down immediately. Option C. Tell the resident it will pass. Option D. Walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 12. Intake and output, INO, is measured to: Option A. Determine how much the resident's meals cost. Option B. Monitor fluid balance, especially in residents with heart or kidney conditions. Option C. Record how often the CNA is working. Option D. Track the resident's favorite foods. The correct answer is option B. Monitor fluid balance, especially in residents with heart or kidney conditions. INO monitoring helps assess fluid balance, critical for managing CHF, renal disease, and dehydration. Question 13. The first step when a resident appears to be choking is to: Option A. Begin CPR immediately. Option B. Ask, "Are you choking?" and observe for signs of airway obstruction. Option C. Start the Heimlich maneuver without assessment. Option D. Offer the resident a glass of water. The correct answer is option C. Start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 14. A resident has dysphagia. The CNA should position the resident for meals. Option A. Lying flat in bed. Option B. Upright at 90 degrees, with chin slightly tucked for swallowing. Option C. Reclining at a 45-degree angle. Option D. On the side. The correct answer is option C. Reclining at a 45-degree angle. The upright position and chin tuck facilitate safe swallowing. In this rotation, C is correct. Question 15. The base of support for good body mechanics is achieved by: Option A. Standing with feet together. Option B. Standing with feet shoulder width apart. Option C. Leaning on one leg. Option D. Kneeling on one knee. The correct answer is option D. Kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 16. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A. Which resident is the most demanding? Option B. The urgency of the situation, prioritizing life-threatening emergencies first. Option C. Which task is easiest to complete? Option D. The CNA's personal preference. The correct answer is option C. Which task is easiest to complete? Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 17. Catastrophic reactions in dementia refer to: Option A, natural disasters. Option B, an extreme emotional outburst to a seemingly minor stressor. Option C, calm, rational responses. Option D, the resident's favorite activity. The correct answer is option A, natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 18. The purpose of a positioning schedule is to: Option A, punish staff who forget to turn residents. Option B, ensure residents are repositioned at regular intervals to prevent complications. Option C, track which residents are incontinent. Option D, document meal consumption. The correct answer is option B. Ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 19. A common sign of impending death is: Option A, increased appetite. Option B, cool, mottled extremities and decreased circulation. Option C, increased energy. Option D, normal vital signs. The correct answer is option D, normal vital signs. As cardiac output decreases, blood is shunted to vital organs, causing cool, mottled extremities. In this rotation, D is correct. Question 20. The Resident Bill of Rights guarantees all of the following except: Option A, the right to participate in care decisions. Option B, the right to free medical care. Option C, the right to privacy. Option D, the right to voice grievances without retaliation. The correct answer is option C, the right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 21. When cleaning dentures, the CNA should: Option A, hold them over the sink without a protective barrier. Option B, use hot water to kill bacteria. Option C, line the sink with a towel and use cool or lukewarm water. Option D, soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 22. Pain is often considered the fifth vital sign. The CNA's role in pain management is to: Option A, diagnose the source of pain. Option B, administer pain medication. Option C, observe and report signs and symptoms of pain using the facility's pain scale. Option D, tell the resident that pain is expected with aging. The correct answer is option C. Observe and report signs and symptoms of pain using the facility's pain scale. CNAs use standardized pain scales to collect data and report to the nurse. Question 23. Validation therapy is used primarily for residents with: Option A, acute pain. Option B, dementia, by acknowledging their feelings and memories. Option C, hearing loss. Option D, physical disabilities. The correct answer is option A, acute pain. Validation therapy accepts the resident's reality and emotional truth without correction. In this rotation, A is correct. Question 24. If a CNA suspects a resident is being abused by a family member, the CNA must: Option A, wait until there is definite proof. Option B, report the suspicion to the nurse immediately. Option C, confront the family member. Option D, tell the resident to call the police. The correct answer is option D. Tell the resident to call the police. CNAs are mandated reporters. Suspicion of abuse must be reported immediately. In this rotation, D is correct. Question 25. A resident in a wheelchair is found slumped over to one side. The CNA's first action is to: Option A, push the resident back to upright quickly. Option B, assess level of consciousness, call for the nurse, and check breathing. Option C, take the resident to their room. Option D, offer the resident a drink. The correct answer is option B. Assess level of consciousness, call for the nurse, and check breathing. This could be a medical emergency. Assessment of consciousness and breathing precedes repositioning. Question 26. A resident is on fall precautions. Which intervention is most appropriate? Option A, keep the bed in the highest position. Option B, place the call light within reach and keep pathways clear. Option C, apply restraints. Option D, keep the room dark. The correct answer is option B. Place the call light within reach and keep pathways clear. Call light accessibility and clear pathways are essential fall prevention measures. Question 27. The CNA notices that a resident's skin is very dry. What should be applied? Option A, antibiotic ointment. Option B, moisturizing lotion, using gentle strokes. Option C, alcohol-based astringent. Option D, nothing, dry skin is normal. The correct answer is option A. Antibiotic ointment. Moisturizing lotion helps prevent skin cracking and breakdown. In this rotation, A is correct. Question 28. Nonverbal communication includes: Option A, telephone conversations. Option B, body language, facial expressions, and gestures. Option C, written notes. Option D, verbal reports to the nurse. The correct answer is option D. Verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 29. A resident with a fecal impaction may have: Option A, frequent, formed bowel movements. Option B, liquid stool seeping around a hard mass in the rectum. Option C, no bowel symptoms. Option D, dark, tarry stools only. The correct answer is option D. Dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 30. A resident with heart failure has a weight gain of 3 pounds overnight. The CNA should: Option A, document the weight and say nothing. Option B, reweigh the resident and, if verified, report to the nurse immediately. Option C, tell the dietary department to reduce calories. Option D, skip the weight and record the previous day's weight. The correct answer is option A. Document the weight and say nothing. Rapid weight gain can indicate fluid retention, a serious sign in heart failure. In this rotation, A is correct. Question 31. When assisting a resident to dangle at the bedside, the CNA should: Option A, stand the resident up immediately. Option B, have the resident sit on the edge of the bed with feet supported for a few minutes. Option C, keep the resident lying flat. Option D, transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 32. The CNA's responsibilities regarding resident valuables include: Option A, keeping valuables at the nurse's station without documentation. Option B, documenting and securing valuables according to facility policy. Option C, taking valuables home for safekeeping. Option D, telling residents to keep valuables hidden. The correct answer is option A. Keeping valuables at the nurse's station without documentation. Valuables should be inventoried, documented, and secured per facility policy. In this rotation, A is correct. Question 33. A transfer belt is applied. Option A. Over bare skin for a secure grip. Option B. Over clothing, snugly around the waist. Option C. Under the arms. Option D. Around the neck. The correct answer is option B. Over clothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 34. When applying a hospital gown to a resident within 4, the CNA should: Option A. Disconnect the 4 to thread the gown. Option B. Put the gown on the arm with the 4 first, then the other arm. Option C. Gather the gown on the tubing and thread it carefully without disconnecting the 4. Option D. Cut the gown. The correct answer is option A. Disconnect the 4 to thread the gown. 4 lines should never be disconnected by a CNA. Gowns are threaded carefully over the tubing. In this rotation, A is correct. Question 35. A resident has a wound infection that requires contact precautions. The CNA should: Option A. Wear only gloves. Option B. Wear a gown and gloves, and use dedicated equipment when possible. Option C. Wear an N95 respirator. Option D. No special equipment is needed beyond standard precautions. The correct answer is option C. Wear an N95 respirator. Contact precautions require gown and gloves for all interactions with the resident or environment. In this rotation, C is correct. Question 36. Which of the following is not a fall prevention strategy? Option A. Keeping floors dry and free of clutter. Option B. Ensuring adequate lighting. Option C. Keeping the bed at the highest working level. Option D. Having residents wear non-slip footwear. The correct answer is option B. Ensuring adequate lighting. Beds should be kept in the lowest position except when direct care is provided. In this rotation, B is correct. Question 37. When bathing a resident, the water should be changed. Option A. When it becomes cool, soapy, or visibly dirty. Option B. Only if the resident requests it. Option C. At the end of the bath. Option D. Never, one basin is sufficient. The correct answer is option C. At the end of the bath. Fresh, warm water promotes cleanliness and comfort. Dirty, cool water is ineffective. In this rotation, C is correct. Question 38. A contracture is: Option A. A new medical diagnosis. Option B. A permanent shortening of a muscle or tendon causing joint deformity. Option C. A type of wound dressing. Option D. A special diet. The correct answer is option D. A special diet. Contractures result from prolonged immobility and lack of ROM. In this rotation, D is correct. Question 39. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A. Apply antibiotic ointment. Option B. Remove the catheter. Option C. Report the findings to the nurse. Option D. Ignore it as it is normal. The correct answer is option B. Remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 40. The dorsalis pedis pulse is found. Option A. At the wrist. Option B. Behind the knee. Option C. On the top of the foot. Option D. At the temple. The correct answer is option D. At the temple. The dorsalis pedis artery runs along the top of the foot. In this rotation, D is correct. Question 41. The normal color of urine is: Option A dark brown, Option B pale yellow to amber, Option C bright red, Option D green. The correct answer is Option D, green. Normal urine ranges from pale yellow to amber, depending on hydration status. In this rotation, D is correct. Question 42. The dorsal recumbent position is: Option A lying on the back with knees bent and feet flat on the bed, Option B lying on the stomach, Option C sitting straight up, Option D lying on the side. The correct answer is Option B, lying on the stomach. Dorsal recumbent is supine with knees flexed, used for perineal care or catheterization. In this rotation, B is correct. Question 43. A CNA notices that a resident's condition has changed. The first action is to: Option A document the change in the chart, Option B call the resident's family, Option C report the change to the charge nurse, Option D wait to see if the change persists. The correct answer is Option C, report the change to the charge nurse. Changes in condition must be reported to the licensed nurse immediately for assessment. Question 44. A seizure is occurring. The CNA should: Option A restrain the resident firmly, Option B insert a padded tongue blade into the mouth, Option C protect the resident from injury by moving nearby objects and cushioning the head, Option D place the resident in a chair. The correct answer is Option C, protect the resident from injury by moving nearby objects and cushioning the head. During a seizure, protect the resident from injury. Do not restrain or put anything in the mouth. Question 45. The purpose of range of motion exercises during bathing is to: Option A exhaust the resident, Option B maintain joint mobility and prevent contractures, Option C speed up the bath, Option D diagnose muscle disorders. The correct answer is Option A, exhaust the resident. Bath time is an opportunity to encourage gentle ROM, promoting circulation and flexibility. In this rotation, A is correct. Question 46. The abbreviation BID means: Option A, once daily, Option B twice daily, Option C, 3 times daily, Option D, 4 times daily. The correct answer is Option D, 4 times daily. BID, bis and die, equals twice a day. In this rotation, D is correct. Question 47. The term nosocomial infection refers to an infection: Option A acquired in the community, Option B acquired in a healthcare facility, Option C caused by a virus, Option D, that is not treatable. The correct answer is Option B, acquired in a healthcare facility. Nosocomial, healthcare associated, infections are acquired during the course of receiving healthcare. Question 48. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A roll the stockings down for ease, Option B apply the stockings smoothly without wrinkles, Option C leave the heels uncovered, Option D apply lotion immediately before the stockings. The correct answer is Option D, apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 49. A resident is on a toileting schedule. The CNA should offer toileting. Option A, once daily. Option B, every 2 hours and when the resident requests. Option C, only at bedtime. Option D, only after meals. The correct answer is option B. Every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 50. When providing morning care, the CNA should encourage the resident to: Option A. Stay in bed as long as possible. Option B. Void, urinate, first, then participate in hygiene. Option C. Skip breakfast for more sleep. Option D. Wait for the nurse before doing anything. The correct answer is option C. Skip breakfast for more sleep. Voiding upon waking is a basic need. Encouraging participation promotes independence. In this rotation, C is correct. Question 51. Informed consent means the resident. Option A was told about the procedure but doesn't need to understand. Option B has been fully informed and understands the risks, benefits, and alternatives. Option C must agree to all treatments. Option D cannot refuse treatment. The correct answer is option B. Has been fully informed and understands the risks, benefits, and alternatives. Informed consent requires understanding of risks, benefits, and alternatives before agreeing to treatment. Question 52. When a resident states, "Nobody ever comes to visit me," the CNA's empathetic response should: Option A. Suggest solutions for making friends. Option B. Acknowledge the resident's feeling of loneliness. Option C. Point out that the CNA visits all the time. Option D. Explain that families are often busy. The correct answer is option B. Acknowledge the resident's feeling of loneliness. Acknowledging the resident's perceived reality without dismissing or immediately problem-solving validates their experience. Question 53. Which of the following is a sign of dysphagia the CNA should report? Option A. Eagerly eating all food on the tray. Option B. Coughing or choking during or after meals. Option C. Requesting seconds. Option D. Drinking quickly. The correct answer is option A. Eagerly eating all food on the tray. Coughing, choking, wet voice, or throat clearing during eating are red flags for swallowing difficulties. In this rotation, A is correct. Question 54. When assisting a resident to dress, the CNA should: Option A. Select the outfit without input from the resident. Option B. Allow the resident to choose their clothing when possible and encourage independence. Option C. Dress the resident as quickly as possible. Option D. Use only hospital gowns. The correct answer is option B. Allow the resident to choose their clothing when possible and encourage independence. Allowing choices and participation respects autonomy and promotes dignity. Question 55. The goal of palliative care is to: Option A. Cure the underlying disease. Option B. Provide relief from symptoms, pain, and stress of serious illness. Option C. Hasten death. Option D. Avoid all medical treatment. The correct answer is option B. Provide relief from symptoms, pain, and stress of serious illness. Palliative care focuses on comfort and quality of life, regardless of disease stage. Question 56. A resident is crying and seems upset. The best initial response is to: Option A. Tell the resident not to cry. Option B. Ignore the crying so the resident can have privacy. Option C. Sit with the resident and ask if they would like to talk. Option D. Immediately distract the resident with an activity. The correct answer is option A. Tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 57. The CNA is caring for a resident on suicide precautions. The most important safety measure is: Option A. Leaving the resident alone to think. Option B. Continuous observation or frequent checks as ordered, removing hazards. Option C. Restraining the resident in bed. Option D. Telling the resident not to think about suicide. The correct answer is option A. Leaving the resident alone to think. Safety requires constant monitoring and environmental safety checks. In this rotation, A is correct. Question 58. A resident with an indwelling catheter has the drainage bag positioned above the bladder. The CNA should: Option A, leave it as is for convenience. Option B, lower the bag below the level of the bladder immediately. Option C, raise it higher to promote drainage. Option D, remove the catheter. The correct answer is option C. Raise it higher to promote drainage. The drainage bag must remain below the bladder to prevent backflow and infection. In this rotation, C is correct. Question 59. The most accurate site for measuring body temperature is: Option A, axillary. Option B, oral. Option C, rectal. Option D, tympanic. The correct answer is option B, oral. Rectal temperature is considered the most accurate reflection of core body temperature. In this rotation, B is correct. Question 60. The CNA is feeding a resident who is at risk for aspiration. The resident should be: Option A, lying flat. Option B, sitting upright at 90 degrees with chin slightly tucked. Option C, reclining at 30 degrees. Option D, standing. The correct answer is option C, reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 61. A resident with aphasia has difficulty: Option A, walking. Option B, communicating verbally or understanding language. Option C, swallowing. Option D, seeing. The correct answer is option B, communicating verbally or understanding language. Aphasia is a communication disorder resulting from brain damage that affects the ability to speak, understand speech, read, or write. Question 62. The CNA is feeding a resident who has had a stroke. The CNA should place food: Option A, on the unaffected side of the mouth. Option B, on the affected side of the mouth. Option C, in the center of the mouth only. Option D, anywhere in the mouth. The correct answer is option D, anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 63. A resident who is being toilet should be given: Option A, strict time limits to hurry the process. Option B, privacy, adequate time, and a safe environment. Option C, a bedpan even if the resident can walk. Option D, instructions to hold it until the next scheduled time. The correct answer is option D, instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 64. The primary purpose of accurate documentation is to: Option A, fill time during the shift. Option B, communicate care provided and the resident's response. Option C, meet state and federal requirements only. Option D, discipline staff who make errors. The correct answer is option B, communicate care provided and the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 65. The correct temperature for a sitz bath is: Option A, hot, about 115 degrees Fahrenheit. Option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Option C, cool, about 85 degrees Fahrenheit. Option D, cold, about 65 degrees Fahrenheit. The correct answer is option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Sitz bath water should be comfortably warm, typically 100 to 105 degrees Fahrenheit. Question 66. The resident's weight is measured as 150 pounds. The CNA should document: Option A 150 pounds only. Option B 150 kilograms. Option C 150 pounds and record in kilograms if the facility uses metric. Option D 15.0 pounds. The correct answer is option D, 15.0 pounds. Many facilities use metric. Follow facility protocol, which may involve converting to kilograms. In this rotation, D is correct. Question 67. The CNA's body language when communicating should be: Option A tense and authoritative. Option B open, relaxed, and attentive. Option C crossed arms and looking away. Option D rushed and impatient. The correct answer is option B, open, relaxed, and attentive. Open, relaxed body language conveys warmth and attention, promoting effective communication. Question 68. The CNA is caring for a resident with a fluid restriction. The CNA should: Option A give the resident a full pitcher of water. Option B measure and offer fluids according to the plan, spreading the allowance throughout the day. Option C withhold all fluids to stay within the limit. Option D give all the fluid at once for the resident to manage. The correct answer is option B, measure and offer fluids according to the plan, spreading the allowance throughout the day. Spreading fluid throughout the day prevents excessive thirst while adhering to the restriction. Question 69. Hemiplegia is: Option A weakness on one side of the body. Option B paralysis on one side of the body. Option C paralysis from the waist down. Option D weakness in all four limbs. The correct answer is option A, weakness on one side of the body. Hemiplegia is paralysis of one side of the body, commonly from stroke. In this rotation, A is correct. Question 70. A resident is on a thickened liquid diet. The purpose of thickening liquids is to: Option A make them taste better. Option B prevent aspiration in residents with dysphagia. Option C increase caloric content. Option D cool the liquids. The correct answer is option A, make them taste better. Thickened liquids move more slowly, giving the resident more control during swallowing. In this rotation, A is correct. Question 71. Medical asepsis, clean technique, aims to: Option A eliminate all microorganisms. Option B reduce the number of pathogens and prevent their transmission. Option C, only clean visible dirt. Option D sterilize all equipment. The correct answer is option D, sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 72. The CNA's role in advance directives is to: Option A help the resident complete the documents. Option B be aware of the resident's advance directives and report questions to the nurse. Option C explain the legal implications to the resident. Option D witness the signing of advance directives. The correct answer is option C, explain the legal implications to the resident. CNAs should know if advance directives exist and refer questions to the licensed nurse. In this rotation, C is correct. Question 73. Proper alignment when sitting in a chair includes: Option A legs crossed at the knees. Option B feet flat on the floor or wheelchair footrests, hips and knees at 90 degrees. Option C slumped forward over a table. Option D, one hip higher than the other. The correct answer is option A, legs crossed at the knees. Proper seated alignment promotes circulation and comfort. In this rotation, A is correct. Question 74. Which of the following is the correct way to label a resident's personal items? Option A. Using the resident's room number. Option B. Using the resident's name and identification number. Option C. Using the CNA's name. Option D. Items do not need to be labeled. The correct answer is option D. Items do not need to be labeled. Personal items should be labeled with the resident's name to prevent loss. Room numbers can change. In this rotation, D is correct. Question 75. The CNA finds a resident with a bleeding wound. The first action is: Option A. Apply direct pressure with a clean barrier and call for the nurse. Option B. Wash the wound with soap and water. Option C. Apply a tourniquet. Option D. Leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 76. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because: Option A. Alcohol-based rubs are too expensive. Option B. Soap and water is faster. Option C. Alcohol is not effective against C. diff spores. Option D. Soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 77. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A. Parallel to the bed on the resident's strongest side. Option B. At the foot of the bed. Option C. Directly facing the bed. Option D. In the hallway. The correct answer is option A. Parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 78. The abbreviation ROM stands for: Option A. Resident on medication. Option B. Range of motion. Option C. Right of movement. Option D. Routine of management. The correct answer is option D. Routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 79. A resident who has been in a wheelchair for an extended period should be repositioned at least every: Option A. 4 hours. Option B. 15 minutes. Option C. 1 to 2 hours. Option D. 8 hours. The correct answer is option D. 8 hours. Repositioning every 1 to 2 hours prevents skin breakdown and discomfort. In this rotation, D is correct. Question 80. The dying resident's sense of hearing is thought to be: Option A. The first sense lost. Option B. One of the last senses to be lost. Option C. Not affected by the dying process. Option D. Completely absent in all dying residents. The correct answer is option B. One of the last senses to be lost. Hearing is believed to persist even when unresponsive. Continue to speak to and comfort the resident. Question 81. A resident who is NPO, nothing by mouth, requires oral care. Option A. Not at all, to avoid stimulating appetite. Option B. More frequently than usual, as the mouth becomes dry. Option C. Once a day only. Option D. Only by a nurse. The correct answer is option A. Not at all, to avoid stimulating appetite. NPO residents experience dry mouth. Frequent oral care is essential for comfort. In this rotation, A is correct. Question 82. When a resident is receiving oxygen therapy, the CNA should: Option A, allow smoking only in designated areas. Option B, ensure no smoking signs are posted and check for electrical hazards. Option C, turn off the oxygen when family visits. Option D, use petroleum jelly to lubricate the nose. The correct answer is option C. Turn off the oxygen when family visits. Oxygen is a fire hazard. No smoking and electrical safety are paramount. In this rotation, C is correct. Question 83. When assisting with meals, the CNA should encourage. Option A, eating quickly to prevent food from getting cold. Option B, socialization in a pleasant, unhurried dining experience. Option C, eating in complete silence. Option D, the resident to eat in their room alone. The correct answer is option D, the resident to eat in their room alone. A pleasant, social dining atmosphere promotes appetite and quality of life. In this rotation, D is correct. Question 84. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A, leave to find the nurse. Option B, call for help and begin abdominal thrusts, Heimlich maneuver. Option C, give the resident a drink of water. Option D, slap the resident on the back. The correct answer is option B. Call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 85. The CNA is unable to palpate a radial pulse. The next action should be to: Option A, assume the resident is dead. Option B, check the apical pulse or carotid pulse. Option C, document absent pulse and take no further action. Option D, shake the resident vigorously. The correct answer is option D. Shake the resident vigorously. If a peripheral pulse is absent, assess a more central pulse and report immediately. In this rotation, D is correct. Question 86. The CNA is transferring a resident from bed to chair. The resident begins to fall. The CNA should: Option A, try to hold the resident up and call for help. Option B, ease the resident to the floor while protecting the head. Option C, step away to avoid injury. Option D, pull the resident back up quickly. The correct answer is option A. Try to hold the resident up and call for help. If a fall is inevitable, guide the resident down and protect the head. In this rotation, A is correct. Question 87. A resident with decision-making capacity has the right to refuse treatment, even if it may result in: Option A, longer stay in the facility. Option B, death. Option C, additional costs to the family. Option D, all of the above. The correct answer is option C, additional costs to the family. A competent adult resident has the legal and ethical right to refuse any treatment regardless of consequences. In this rotation, C is correct. Question 88. When turning a resident onto their side, the CNA should place: Option A pillow under the resident's back only. Option B, a pillow between the knees and another supporting the back and top arm. Option C, the resident's top leg straight down on the mattress. Option D, no pillows for correct alignment. The correct answer is option A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 89. A resident is on a mechanical soft diet. Which food is appropriate? Option A, raw vegetables. Option B, ground meat, scrambled eggs, and mashed potatoes. Option C, nuts and seeds. Option D, tough, chewy meats. The correct answer is option A, raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 90. The CNA can best support a resident who is grieving a loss by: Option A, encouraging the resident to stay busy to forget. Option B, avoiding any mention of the loss. Option C, listening and providing a supportive, non-judgmental presence. Option D, telling the resident that time heals all wounds. The correct answer is option D, telling the resident that time heals all wounds. Grief is normal. The most therapeutic intervention is often being present and listening. In this rotation, D is correct. Question 91. To prevent plantar flexion contractures, foot drop, the CNA should: Option A, keep the feet in a dependent position. Option B, use a footboard or supportive device to keep feet at a 90-degree angle. Option C, place pillows under the knees. Option D, leave the feet unsupported at all times. The correct answer is option C, place pillows under the knees. Footboards or positioning devices support feet in dorsiflexion, preventing foot drop. In this rotation, C is correct. Question 92. Decubitus ulcer is another term for: Option A, skin tear. Option B, pressure ulcer or bedsore. Option C, surgical incision. Option D, burn. The correct answer is option A, skin tear. Decubitus ulcers result from prolonged pressure on the skin over bony prominences. In this rotation, A is correct. Question 93. A CNA's personal belongings should be stored: Option A, in the resident's closet. Option B, in a designated staff area away from resident care areas. Option C, at the nurse's station. Option D, in the clean utility room. The correct answer is option B, in a designated staff area away from resident care areas. Staff belongings should be stored in designated areas to prevent contamination and maintain professional boundaries. Question 94. A resident repeatedly asks to go home. The best response is: Option A, you are home now. Option B, you can never go home. Option C, tell me about your home. Option D, ignore the request as it is not reasonable. The correct answer is option D, ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 95. A resident who is intubated and cannot speak may communicate using: Option A, only verbal communication. Option B, writing, picture boards, or gestures. Option C, no communication methods exist. Option D, telepathy. The correct answer is option C, no communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 96. Silence as a therapeutic communication technique. Option A, should be avoided as it is awkward. Option B, can allow the resident time to think and process feelings. Option C, is only used when the CNA doesn't know what to say. Option D indicates the conversation is over. The correct answer is option D, indicates the conversation is over. Purposeful silence gives the resident space to reflect and collect thoughts. In this rotation, D is correct. Question 97. When providing care, the CNA should address the resident by: Option A, honey or sweetie. Option B, the resident's preferred name, as indicated in the care plan. Option C, their room number. Option D, their medical diagnosis. The correct answer is option D, their medical diagnosis. Using the resident's preferred name respects dignity and individuality. Terms of endearment without permission can be demeaning. In this rotation, D is correct. Question 98. A confused resident is yelling loudly in the dining room. The best approach is to: Option A, yell back for the resident to be quiet. Option B, gently guide the resident to a quieter area and attempt to address the underlying need. Option C, isolate the resident in their room as punishment. Option D, ignore the behavior. The correct answer is option C. Isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 99. The Heimlich maneuver, abdominal thrusts, is used to treat: Option A, cardiac arrest. Option B, complete airway obstruction, choking. Option C, seizures. Option D, shock. The correct answer is option B. Complete airway obstruction, choking. The Heimlich maneuver creates pressure to expel a foreign body blocking the airway. Question 100. Polyuria refers to: Option A, scant urine output. Option B, excessive production of urine. Option C, painful urination. Option D, blood in the urine. The correct answer is option C. Painful urination. Polyuria is commonly seen in uncontrolled diabetes mellitus. In this rotation, C is correct.